Welcome to Unit 3, Lesson 3 of Principles of Health Science. Today we're looking at confidentiality and HIPAA. So confidentiality relates to healthcare because it started with Hippocrates. And this guy, in his Hippocratic oath that we talked about before, said that private information has to stay private. So he promoted that there should not be breaches of confidentiality because it's not only unethical in his standard, but it's illegal. But how is this illegal? Well, all information concerning patients is considered privileged information and should only be shared with hospital employees that are caring for the patient. And this is the purpose of HIPAA. What does HIPAA stand for, though? It stands for the Health Insurance Portability and Accountability Act. Now, Congress passed this landmark law to provide consumers greater access to healthcare. So how does HIPAA create greater access to healthcare? Well, it stopped insurance companies and people from denying health access to new healthcare policies, from restricting access to people with pre-existing conditions, and it also helped people keep job sponsored healthcare after losing their job. So greater access. Now, it also gave protection of protected health information. So, protect. And then it promoted standardization and efficiency in the healthcare industry. So because it changed the way information was shared, it promoted more efficiency. So standardization. And HIPAA has 4 parts. So this is important that you understand, but the 4 parts of HIPAA are electronic transactions. That's the first part. So, electronic. What are electronic transactions? Well, transactions are activities including the transfer of healthcare information, and code sets are codes used to identify specific diagnostic and clinical procedures on claims and encounter forms. So it created electronic transactions and code sets that are given to conditions. The code sets create that standardization. And then the second part of HIPAA is going to be privacy requirements. And the privacy requirements govern disclosure of protected health information, or PHI, while protecting patient rights. So, PHI is protected. Now, it has to be shared to your doctors and stuff, but it's protected in the sense of pertaining to patient rights. Now, there are security requirements in the HIPAA parts, and these security regulations adopt administrative, technical, and physical safeguards to prevent the unauthorized access to personal health information. So, these are security. Let's just draw a lock. Okay? And then for number 4, there's going to be national identifier. This is very important that you know, but HIPAA will require healthcare providers, health plans, and employers have a standard national number. Each of them has a national number that identify them on standard transactions. So the people who are covered entities in HIPAA will have national identifiers, and we will talk more about who covered entities are. But let's say, so each healthcare provider and all these people that are covered entities will have a national identifier. So covered have number. Let's just write number. Okay, so those are the 4 parts of HIPAA, and it's important that you know them. So make sure you study this, especially for your midterm, because that will be on your midterm. Now, what are covered entities? Well, who is affected by HIPAA? Well, that's the big question. And the answer is anyone that's in contact with health information, but there are specific people who are known as covered entities that have to abide by HIPAA. And this starts with medical health care providers. So healthcare providers are anyone in medical or health services or supplies who transmits any health information in electronic form in connection with a transaction for which standard requirements have been adopted. So that's a long definition, but it's basically anyone in contact with health information that can type and do things like that, and that includes a ton of people. This includes nurses, doctors, therapists, athletic trainers, everyone who types things. So this is going to be our healthcare providers, and I'm using HC for healthcare provider. And then there's going to be health plans, and these are going to be your insurance companies. So healthcare plans. And then there's going to be health clearinghouses, and this is a public or private entity that transforms healthcare transactions from one format to another. So if you're sharing information and all of that, then that is a clearinghouse. And what does a clearinghouse do? Well, let's write that too. So if you have X in a clearinghouse, then the clearinghouse turns it to Y, changes format. Okay, so that is who HIPAA applies to. And then there are penalties if you don't apply or you don't comply to HIPAA, not apply. So what are some penalties? Well, non-compliance in a civil offense, meaning that you didn't mean to do this and it wasn't a planned offense, is going to be a penalty that carries $100 per person per violation, and a maximum of $25,000 per year per incident. So max is going to be $25,000. So the fine can be up to $250,000 for criminal and 10 years in prison. Let's draw a jail cell. Okay. And then confidentiality means keeping all privileged information private. So keep private stuff private is basically the best definition. And this includes information pertaining to patient's diagnosis, medical history, and lifestyle. You need to know this. There's only 3, and these 3 will be tested. So confidentiality pertains to 1, diagnosis. Your 2, medical history. And then 3 is going to be your lifestyle. Does it pertain to marriage? No. Does it pertain to anything else? No. Now, these are the only thing. Now, could marriage be a part of lifestyle? Yes. But this is the list, and this is what you're going to pick on the question that's going to be on your test. So, while at work, discussions of protected health information is going to be our PHI, should not be disclosed in elevators, gift shops, cafeterias, anywhere, because if you disclose it without the patient's rights, without asking the patient, and they are not a covered entity here, then you just committed a crime that is a civil crime. Now, if you did it for your own gain because they asked you for a criminal reason, then there you go, that's a criminal offense. So do not do that. And this even applies to you at the hospital, so don't disclose anything you see outside of the hospital to anyone. And in all states, certain patient information is exempt by law, and reports to proper authorities are required without patient consent. Now, what are these things that are required? Well, it's going to be so let's draw a star for required. And this is going to be births and deaths. So, birth/death. And then there's going to be emergencies. So instead of that, let's draw anything that is an emergency. Okay, that's a siren. And then there's going to be your injuries caused by violence. So if you hurt yourself or somebody hurts you, then that should be reported to proper authorities. So that's a knife. And then finally, there are threats of bodily harm that may be reasonably believed. So that is going to be threats. So if you say something that you're going to harm someone else or you're going to harm yourself that are reasonably believed. So threats. And then there's going to be child abuse, which has to be reported, and all types. And then car accidents involving drugs and alcohol. So anything that would be a car crash, but it must be stuff that people are under the influence for. So car, and then the car crashed, and then they were under the influence, okay? So that is what has to be reported. And then finally, anything that is a reportable, communicable, sexually transmitted disease, okay? So STDs. And that is what the registrars and stuff are created for. So there is 7 things that are reported. Is a fire part of this? No. If there's a fire, you don't have to report the fire. So unless it is obviously done in harm to you. So that is the list of things that must be reported to authorities without patient consent. Okay, and then health professionals should respect confidentiality when treating minors. Now, minors are people under 18, and they should be allowed to give verbal consent when given medical care. So let's make a list of things that people should do when they treat minors. They should be able to consent. So you don't just grab someone. You have to say, can I see your arm? Can I do this? Can I do that? And then confidentiality of minors may be ethically breached when parents need to be informed of treatment or serious illness. Now, the breach is allowed, but it can only be in certain things. So if they have reproductive rights in certain states, the minors over a certain age don't have to report things like abortion and things like that. But usually it can be breached for certain things. So breach, not applicable to reproductive stuff. So in certain states. Other states will require parental involvement. And this could be things like abortion or birth control. Okay, and then it must be remembered that medical records are legal documents. Now let's talk a little bit about medical records. Factual. And they have to be, questionable information should be labeled as opinion or assumption. So if you can't prove anything, then label it as a assumption or question or opinion. So questions should be labeled. And then your information that is not relevant to patient care should not be recorded. So info not about patient or not patient information should not be in it. Okay, and then finally there should be erasures are not allowed. So you cannot erase things on medical records, but you can cross it out in a single line so that a mistake is still readable. So erasing is not allowed. So let's practice how they want it. So you draw a single line so that mistake is still readable, and then correct legible information should be inserted, initialed, and dated. So let's write erasing, and then let's say not allowed. And then I'm going to write the initials. So my initials are TV, and then dated. So today is the 31st. And then explanations for correction may be given. So let's give an explanation that says no erasing. Okay. So that's how erasing information should be done. And many individuals who work in the hospital have access to patient records, and healthcare providers must create safeguards to maintain computer confidentiality. So, what does this mean? Well, the providers have to make sure that limited personnel have access to healthcare information. So let's say we have 4 people, let's say 3. Well, we want limited access, so only this one has access to healthcare information. And then use codes to prevent access to certain information. So this guy is going to create a code called XOXO 2002 PHS. That's going to be my code to protect my patient information. And then requirements of password to access specific information. So this is going to be the password, and this is going to be my code is going to be let's say 10. My code is 10. And then constant monitoring of computer use. So this guy is going to constantly look at his computer with big eyes, constantly viewing the computer, constant monitoring. And then ways in which medical professionals should safeguard confidentiality. Okay, so my medical professional is never gonna disclose information to a third party without signed consent from the patient. So if the patient doesn't want to share the information with other people, you don't share it. So ask for a signature. Signed only disclosure. And then do not decide confidentiality on a basis of personal approval or thought. So he's not going to use his brain, he's going to use the patient's brain. So your brain, no. And then never reveal financial information about a patient, including account balance. So disclosure even in regards to money. And then when talking on the telephone to a patient, do not use the patient's name if others in the room might hear over. So I'm going to say no name. When this guy talks, he's going to talk on the phone, but he's going to say, I don't know how they'll refer to it, but he's going to say my patient instead of their name. And then when leaving a message on a home answering machine or a patient place of employment, simply ask the patient to return the call. No mention should be made of concerning results. It is inadvisable to leave a message with a coworker or receptionist to call a person. Okay, so when they talk on the phone or leave a message, their message is going to be in, they're going to say, please return the call. Okay, and then do not leave medical charts or insurance reports where patients or office visitors can see them. So he's going to use a filing cabinet with a lock to put all his records inside. And this is going to have his charts. There's going to be a key to get inside. Okay, but the final takeaway is that whether you are a doctor, nurse, receptionist, janitor, or a student, you are legally responsible for maintaining confidentiality. So you need to follow this. If you are at the hospital, don't talk about anything in the elevator. Don't share what you see at home. It doesn't matter. If you see your neighbor, don't wave to them, because the hospital is a confidential place, and you being a healthcare student matter, and you don't need to commit a civil offense.